Welcome back to my channel. My name is Rebecca. Hope you're doing well, and it's nice to see you all again. Today I'm going to be talking about the four main nursing fields in the UK, and apart from that I would also be talking about other areas that you can apply to when you're here and you've worked for a couple of years. So this is for you whether you're already in the UK working as an overseas or international nurse, or if you're an overseas nurse living in Africa, in the Caribbean, Philippines, or India, and you're thinking of coming to work in the UK. I think it's important for you to know the different nursing fields so you know which one to apply into depending on what your current registration is. So we have adult nursing, so general adult nursing. We have children's nurse, we have learning disability nurses, and we have mental health nurses. All these nursing fields are regulated by the NMC, and with all your qualifications as above, you can work either in a community hospitals, you can work in acute trust or hospitals, nursing care homes. Now, with a few years of experience, it could be a year or 18 months of experience or 2 years of experience, you can actually apply to become a specialist nurse. Some of these roles, you can get into them through training. Sometimes it could be training on the job. It could also be once you've started doing that job, you would be sponsored to do some courses to help you practice effectively. So I'm going to mention a few of them. We have public health specialist nursing fields, and those are either school nursing, we have health visiting, there is occupational health nursing. So these ones are specialties where after you have worked as a general nurse for a year or two experience, then you can apply for a degree course or postgraduate course to do either health visiting, school nursing, or occupational health nursing. We have district nurses as well, and we do have general practice nurses as well. Apart from that, we have other specialties for nurses to work in. So one of them could be sexual health nurse specialist. We have psychiatric nurses, that's community psychiatric nurses. We do have oncology nurses, epilepsy nurses, Parkinson's disease nurses. We have DVT specialist nurses, respiratory, urology, stoma, HIV nurses, we have dermatology nurses, we have hepatitis specialist nurses, TB specialist nurses, we have prison nurses, we have sickle cell and thalassemia specialist nurses. So that is my specialist field. So I'm a specialist nurse for sickle cell and thalassemia. As time goes on, I would be talking more about my specific role to you at some point. And we do have nurse educators, vascular nurses, so they can actually insert lines for people who are going for specific procedures that require central lines and femoral lines and all that. And finally, we do have agency nurses as well. So agency nurses are nurses who, it could be general adult nurse, it could be mental health nurse, and you decide you want that independence because working in a full-time job, sometimes if you have children, it's difficult for you to have that flexibility. So some people decide to go into agency, they work for agencies, and they pay themselves, they pay their own taxes and all that. So basically there's a lot to all of these. All of them have their own advantages and disadvantages, but basically these are the different specialties that we have, and as a nurse you can grow in whatever specialist or specialty area you want to work in. Anyway, I'll leave it here and have a lovely week, and I shall see you again next week Sunday. Thank you, and remember to subscribe and share.